60 volunteers with Operation Walk Denver came to Guatemala in April 2010. They came to mend the broken, heal the damaged, and perform life-changing surgeries on some of the poorest people in the Americas. Though Guatemala has wide, tree-lined boulevards, gleaming skyscrapers, and modern malls, 70% of the people here have no health care insurance. For the poor, the destitute, and the damaged, medical care is like a throwback to a distant and dark era. Without proper health care, people who are injured at work or worn out from age or arthritis know only suffering. For many, each step taken is more agonizing than the last, and the pain will last for life. This is why the surgeons, nurses, and therapists with Operation Walk Denver have come to Guatemala. Operation Walk is a not-for-profit volunteer medical organization that provides free surgical treatments for patients in developing countries and in the United States.
We can come here and with just really limited funds help people get better right away, get back to more active lives, and really be functional members of society. And that's something that you can't really put a price on. When you see the face of these people and you're taking them from being crippled in a wheelchair and suddenly they're able to walk and they're able to care for themselves, able to care for their families, there is no price you can put on that. A lot of these patients have crippling defects in not only one side but the other side, and it just seems to compound their problems. So that's what we're trying to do, is probably help around 60 people, but do about 80 joints if at all possible. An early group that comes, gets things set up, the cargo put away, the implants sorted. We start seeing patients in the clinic, start sorting out the patients that we can do surgery on, the patients that we can. We look at their medical status, look at their deformities. Once they're pre-screened for surgery, we take them into surgery and we will do whatever cases we need to do to repair their deformities. Once we know that the patient is doing well and they've been transferred to the floor, we give them a little while to rest up, get their strength back, and then we get them up and moving.
Walter Palacios is like many of the people Operation Walk Denver hopes to serve. Walter is typical of Guatemala's poor. He lives in a crime-ridden shantytown, one of several that ring Guatemala City. These impoverished communities of tin and concrete snake along the shallow ravines around Guatemala's capital city. The crowded shantytowns are home to tens of thousands of Guatemala's poorest souls. Walter lives in a 400-square-foot home. He shares the living space with 12 relatives. It's a hard life, one made more difficult 3 years ago when Walter fell off a 2-story roof while at work. The fall shattered his hip and left him unable to work. A local surgeon did his best, but the operation left Walter with severe arthritis. Walter has not worked since that fall. He needs crutches just to stand outside his home.
I know it's wrong to think bad things, but I wondered if things would be better off if I had died in the fall. Sometimes I think I should just kill myself because I can't fulfill my role and provide for my family. I get depressed thinking about life, and it hurts when I see my family suffer. I've tried to get help, but in Guatemala, poor people like me have no chance. We can't afford to pay for a good doctor. I don't know if the surgeons from Operation Walk will want to help me. I don't know if I will qualify for surgery or if I'm a good candidate for their care. I know I'm just hoping for a chance. I want to be able to sleep without pain. I want to get better. I want to find a job, and I want to help my family.
It is day 2 of Operation Walk Denver's week-long mission, and Walter has come to the hospital for a final round of exams. The results of these tests will determine whether the American surgeons can take on Walter's difficult operation.
See his other normal hip. It's got a nice round ball and a nice space around it. You can see that this head is essentially dead. The technical difficulty with his case is he's essentially fused his hip and it doesn't move at all. So it makes my job a hell of a lot harder when the hip doesn't move. But I think we can go ahead and tackle this one while we're here.
If this is successful, what's that going to mean to him?
Well, he'll get rid of his crutches and get out of the wheelchair.
Dr. Haas's decision is the news Walter has waited to hear. Finally, after years of suffering, pain, and depression, Walter will have a chance to walk again. If all goes well, he'll be able to find work and help support his family. The news is also good for Gladys Fajardo. She has severe arthritis. Gladys's knees have fused over time. She can't extend her legs and has remained in a wheelchair for years.
Probably the most complex case that I have operated on this trip to Guatemala is a gal who's only 54 years of age. She has severe rheumatoid arthritis, has never in her life received the care that she should have received. She has been in a wheelchair for 6 years, has not been able to walk, and both of her knees have what we call fixed flexion contractures. Her one knee is stuck at 80 degrees and cannot go straight, and her other knee is fixed at 65 degrees of not being able to extend. And in layman's terms, her knees became formed and glued to that wheelchair. I had never done one quite this complex. To go ahead and do this surgery, obviously you have to get the knees out straight. When you straighten the leg out, you have to be extremely careful. I'm so excited. I was just up checking her in the recovery room, and her arteries, her pulses are perfect. She is wiggling both of her ankles up and down, which means all of her nerves work, and now she has, 2 straight knees. And I have no doubt that she will walk again.
While Gladys recovers from her double knee replacement, Walter undergoes a final check before his life-changing hip replacement operation is set to begin. It will take a team of surgeons nearly 3 hours to repair Walter's damaged hip.
To review, years ago, he fell off a roof and broke his hip. He required a surgery. That surgery healed his broken hip, but the plates and screws still remained. His hip slowly became arthritic, and today we were taking out the old plates and screws and replacing the hip to treat his arthritic hip pain. In order to do a hip replacement, you have to grind out the bone and shape it to accept the implant. We did that in his socket, and we did that in his thigh. You put the hip together, and then the hip is able to move pain-free, no more arthritis. The future is that Walter still has to heal the surgical wound and heal his bone to the metal parts that we just gave him. That can take several months, but his pain from arthritis should quickly go away. And with the appropriate physical therapy, he should slowly get stronger and stronger and return to as many activities as he wishes.
It's been 2 months since his operation, but Walter is nearly healed. He can finally walk without pain, and he's received job offers for the first time in 3 years.
This operation has changed my life. It's also changed the lives of my family. Now I'm going to have a chance to work again. That means I can bring money into the household and take care of my growing family.
Gladys has also recovered. She's walking for the first time in 6 years.
Before the Operation Walk team of Denver came, I was confined to a wheelchair. I was only able to move inside my room, and now after the surgery I can do all the things that I like to do. And I also encourage all these people from Operation Walk and other patients from Guatemala to come here to Funda Orto and look for help. And I bless the Operation Walk team of Denver.
Operation Walk volunteers performed 175 surgeries on more than 150 patients last year. Operation Walk Denver could do more if they had more.
We have a very privileged lifestyle here, and I feel like one of the best ways that I can say thank you for the opportunities that I've been given from an educational standpoint, from living in a privileged country, is to be able to go and take care of my brothers and sisters in other countries. They're great people, but they weren't maybe born into the same privileged situation than I was. And I think if you have a gift and you have the chance to go and help somebody out who's in a less fortunate situation,
you have to do it. And it's really my favorite week of work every year.
And in Colorado, everyone's fortunate that most people have access to a healthcare system. You come to these places where people have one shot in their life to change their life around. Fixing a knee, fixing a hip may seem something very ordinary to us back in the States, but out here it's a life-saving event. These procedures we're doing is getting people back to a quality of life, to get back into being a product of society, getting them off a chair that they can actually walk. They are so disabled, they've never seen a doctor before, and their arthritis is so far advanced. Their most simple cases are our most complex cases.
Think about all the things that you have and think about the important things in life, and with just a little effort you can change the life of so many people, which it is something great. You will change his life or her life and they will be able to be happy again.
When you give $1 to Operation Walk, you're pretty much helping bring wellness to people and their lives. You are becoming part of those surgeons' hands. You're part of that team that is going to that person's family and saying, we're going to get your father better, we're going to get your mother better. They're going to be able to take care of you. They're going to be able to be productive members of society. But here, these people have no hope. And there is no greater work, I think, on earth than to be able to help somebody else. If you're a Christian, which I am, I just sort of say this is what Christ's mission on earth was, to make people's lives better.